When infection attacks the body, anti-infective medications can help rid the body of the invading organism. There are 4 types of anti-infective drugs: antibiotics, antiviral, anti-tubercular, and antifungal. To select appropriate anti-infectives, several things must be considered. First, the microorganism must be isolated and identified. Then it must be determined which drugs are effective in treating it. This may take as long as 48 hours, so doctors will often send the specimen to the lab and then treat it with a medication that will usually take care of the symptoms he or she sees. This is the reason that the doctor may change an antibiotic after the results are back. Another consideration has to do with the location of the infection. For the drug to be effective, an adequate concentration of the medication must be delivered to the infection site. The last consideration deals with the cost of the drugs, as well as the potential adverse reactions and the possibility of patient allergies. When taking anti-infectives, it's important to remember: take the medication exactly as prescribed. Take all of the medication, even if you're feeling better, unless directed to do otherwise by the physician. Some anti-infectives may decrease the effectiveness of oral contraceptives. Be sure to read your medication information resources. Report unusual reactions such as rash, fever, or chills. Don't take leftover drugs from a previous illness or take someone else's medication. Store appropriately. Some may require refrigeration or protection from light. Summing it up, you have now completed all of the modules. You will be required to pass the checkpoint quiz on common medications as you have on previous modules. Feel free to review all of the modules on MedEd America's YouTube channel before taking your final examination. The final exam has several scenarios that ask you, given a situation, what would you do? Very similar to the several of the Practice Makes Perfect activities. The final exam focuses primarily on the law, rules, and techniques needed to safely and properly supervise the self-administration of medication and the administration of medications. You must pass the final exam with a score of 80% or better. As with the checkpoints, if you do not pass, you will be able to review the material on MedEd America's YouTube channel and retake the test. After submitting the evaluation, you will be able to print your certificate of completion. Copies are available by clicking on the Current Certificates tab in the navigation bar. Questions and comments related to the course are welcome. Please email me at pat@MedEdAmerica. Good luck, and thank you for allowing MedEd America to assist you in obtaining certification as a medication administration provider.